Hi, my name is Wilma Varela, and this week's topic is urinary retention. So, urinary retention is the inability to empty the bladder completely, and it's categorized by acute and chronic urinary retention. So now the difference between acute and chronic urinary retention is that acute urinary retention, it happens suddenly and lasts only for a short period of time. The person cannot urinate at all, even though they have a full bladder, they can't really urinate. And also it requires immediate emergency treatment because it's life-threatening and it's very painful for the patient. Now, chronic urinary retention, it's a long-lasting medical condition, and the person can urinate in this case, but they do not completely empty all of the urine from the bladder. So often these people don't even know that they have the condition until they develop other problems like a UTI or a urinary incontinence. So this is a quick picture of what a normal bladder would look like and what a bladder with urinary retention looks like. And you can tell here that the bladder is full and it's not completely emptied out, and it's very painful for the patient. The causes of urinary retention could be from obstruction of the urethra, from nerve problems such as diabetes, stroke. It could also be from medications. Certain medications like antihistamines cause a urinary retention, and a weakened bladder muscle. Now, symptoms vary according to the category. If it's an acute urinary retention, then the patient might have an inability to urinate, obviously, and it can be very painful to urinate, and they might have pain or discomfort in the lower abdomen, and the abdomen is also bloated. So nursing assessments that needs to be prioritized in this case is obviously the assessment of the abdomen, and also asking the patient how often do you urinate per day, what's the amount, and does it hurt to urinate? Okay, so with chronic urinary retention, the symptoms that your patient will present with is urinary frequency. They might use the bathroom 8 or more times per day. They have trouble beginning urine stream, and they have a weak or interrupted urine stream, an urgent need to urinate, but when they actually do urinate, it's only a little. And the feeling to need to urinate right after they just urinated. And they might have a mild and constant discomfort in the lower abdomen as well. So some diagnosis, the healthcare provider might diagnose this with a physical assessment or a post-void residual measurement, but to really identify what caused the urinary retention, the healthcare provider might need a cystoscope, a TC scan, or a urinamic test, or a electromyography to know what the cause of this urinary retention really is. Some treatments that the healthcare provider can use for the urinary retention is bladder drainage. This involves using the catheter to drain out the urine in the bladder and release the tension. and also urinary dilation, urethral dilation, actually, urethral stents, and prostate medication. If it's prostate cancer, that's the issue. And sometimes the patient might need surgery, like with prostate cancer, they might need the surgery. With other tumors and cancers, and also it could be a cystocell repair.